It's one of the most common medical conditions. Chronic pain affects as many as 1 in 10 Americans and costs the U.S. economy more than $90 billion per year in medical costs, disability payments, and lost productivity. Chronic pain can last weeks, months, or even years. No matter how acute or how long it lasts, one thing is certain: pain is very disruptive to a person's life. Paul Furness knows this all too well.
I've had neck pain for a long time. It's gotten progressively worse over the years, and also lower back pain. And it got to the point where I could only walk about 100 to 200 feet without having tremendous pain in my hips.
When it comes to treating pain, a physician can determine the appropriate therapy based on a patient's symptoms, their history, and the results of examination and testing. Some patients can get relief through medications, while others might even require surgery, with no guarantee of success. Today, specialists in pain medicine can greatly reduce pain using a variety of minimally invasive injections and procedures, all without invasive surgery.
Basically, interventions are procedures, things that are done to try to target the source of the pain and either eliminate or greatly decrease the pain, as opposed to covering it up with oral medications or even doing more aggressive treatments such as surgery, which is obviously much more invasive and risky.
Many people, including physicians, may not be aware of all the treatment options available. Some of these effective interventional treatments include epidural nerve blocks, which deliver pain relief from herniated discs, sciatica, and stenosis; facet injections, which relieve inflammation and pain of the spine; specialized joint injections to alleviate joint pain; kyphoplasty, an outpatient procedure that stabilizes bones after a spinal fracture; ultrasound-guided peripheral nerve blocks; and spinal cord stimulators, devices implanted underneath the skin that send electrical currents to affected areas and block the pain.
I think it's important that people know about these types of treatments because some of the alternatives are less than ideal. For instance, taking chronic, very high-risk medications such as narcotic or opioid pain medications may not be necessary for some people in chronic pain. Also, compared to surgery, for instance, you would look at the types of procedures we do as often being able to avoid something more aggressive like surgeries. Often we can tell you exactly what we can and can't do to help your pain.
Paul found relief through a combination of medications and injections. Today, he's feeling back to his old self.
The doctor has to find where the problem is, and he was able to do that. And I'm much better now. In fact, I have full motion of my neck now for the first time in 12 years.
People don't have to suffer. I mean, that is the main thing that I would like them to know, that there are options for helping you feel better. There may not always be a cure that can eliminate the problem, but there is almost always treatments that can greatly help.
Lanier Interventional Pain Center helps patients reclaim their active lifestyles. These skilled professionals deliver accurate diagnoses and advanced individualized pain treatment. Lanier Interventional Pain Center is led by Dr. John L. Givogre at this state-of-the-art facility in Gainesville, Georgia.
Most of the pain we treat is chronic pain, pain that has continued beyond the time frame that it should have gotten better. And we see as our goal helping people live with their pain and, if possible, eliminate their pain.
The team at Lanier Interventional Pain Center treats many different types of pain, including back and neck pain, joint conditions, and headaches. After careful assessment, Dr. Givogre and his team Lanier create a tailored, comprehensive treatment plan for each patient. Potential therapies include X-ray-guided spine and joint injections, radiofrequency treatments, vertebroplasty and kyphoplasty, prolotherapy, spinal cord stimulation, and many more.
Giving people relief of pain is one of the more satisfying things that you can do, and to see the look on someone's face when they come back for a follow-up visit and they're beaming and you know that what you've done for them has made a big impact in their life, the rewards are beyond financial or fame or anything else that I can hope to accomplish in my practice. I consider this my calling. I enjoy doing this so much that I look forward to going to work and helping people.
Whether their pain is caused by an accident, a strain, or the result of aging, Lanier patients say their results are remarkable.
I have osteoarthritis in my neck and spine, and that causes knots to form in my neck muscles and shoulder muscles and back. The trigger point injections break up those knots, and it decreases the pain, and then I'm most of the time able to function normally for several weeks after the treatment. Dr. Gray is very knowledgeable. He's very gentle, and he listens to you.
Started when I was age 35. I picked up an air compressor motor, and I popped a disc in my back. And then someone told me about Dr. Gray, and I came to him, and that's when I started getting some relief from my pain. Dr. Gray to me is probably my guardian angel. He's a godsend for me. I haven't been on a horse in probably 10, 15 years, maybe longer. I just recently got back from Wyoming and Montana, and I got on a horse. He was actually a mule, but I got on him and I rode him for a little while, and actually when I got off of him, I didn't hurt.
People who work here are professional. They obviously care very much about the patients. It's wonderful. It's great to be as pain-free as I am these days. And I have them all to thank for it.
If you live with pain, don't suffer another day. Contact Lanier Interventional Pain Center, advanced treatment for acute and chronic pain. Visit us online at lanierpain.com.